Good afternoon, everybody here in person and out there as well on Zoom. You're very welcome to this second faculty forum, this one on public and patient involvement in health sciences research. And we're very glad to have a great lineup of speakers and panel discussion for you this afternoon. I know there's people still making their way in. We'll get started in just a moment. So it gives me a chance to thank especially Lena Doherty in the faculty and Michael Foley for organizing the event this afternoon, and credit to them for getting, as I said, a great range of speakers and participants this afternoon. We'll have three speakers for about 20 minutes each. That is Michael Foley himself, who's the program manager in the Trinity PPI Ignite office. We'll have Kate Morris, who's the head of Campus Engage in the Irish Universities Association, and someone many of you know, Professor Mary McCarran, who's chair of Aging and Intellectual Disability here in Trinity, as well as many other roles that she plays as well. And for the panel discussion, we're very fortunate to have Owen Cotter from the Global Brain Health Institute, who's the program lead of learning experience. We have Patricia Doherty from the Trinity St. James's Cancer Institute, who's the senior research program officer and the OECI coordinator. Catherine Buckley, the quality coordinator who runs the Cancer Patient Representative Group. Professor Deirdre Daly, who's associate professor here in the School of Nursing and Midwifery and PI for the Maternal Health and Maternal Morbidity in Ireland study, which we know as MAMI. And from the UK, we have Beck Hanley, a consultant with many years of experience in developing PPI. So without further ado, I'd like to welcome Michael Foley, who's going to give us the first talk this afternoon. Thank you, Michael.
You are all very welcome to this faculty forum on public and patient involvement, or PPI. My name is Michael Foley. I'm the program manager for the PPI Ignite office here in Trinity, and we are just one of a number of offices in the different institutions around the country that are working on the development of public and patient involvement in universities. It's always useful to make sure that we're all on the same page, but what is public and patient involvement? I tend to go back time and again to the definition that the Health Research Board uses, because I'm sure for most people who are both online and here, this is probably the one that you've seen and are most familiar with. It's the one that really comes from Involve, which was then assumed into the National Institute for Health Research in the UK. And public involvement in research is research carried out with or by members of the public rather than to, about, or for them. So in its simplest sense, it is working with patients and members of the public in order to create and develop and manage and promote research. What's often useful to make a distinction is to think about it in the context of participation, engagement, and involvement. Participation is when the person is the subject of the research. They are the entity from which you are gathering data, and that this is a very laudable role for people to play, but that it is not the same as involvement. The patients are subjects and they are who you are gathering data from. In terms of engagement, then you are looking at researchers promoting the work that they've done, giving public talks, or maybe writing articles. And that is engagement with the broader community. But involvement is more closely aligned to a partnership. So it is patients and members of the interested public working with researchers to plan, design, manage, evaluate, and disseminate research. Now, it's possible that they're not doing all of those things, but that certainly they are involved at that level where they are adjacent to the research team rather than being the subjects of research. And I also appreciate that there are a lot of other terms that fly around that people hear about, that they hear about PPV, which is public and patient voice, patient involvement, public involvement, patient engagement, public engagement. These are terms that are quite similarly aligned to PPI and are often used interchangeably with it. Then you have a term like engaged research, which moves above and beyond the health research field and into all kinds of areas like environmental science or into legal studies and all kinds of things. But that engaged research, and Kate Morris will speak about this in more depth, engaged research is very much about engaging with stakeholders and working with stakeholders in order to react to the societal challenges that are faced. Then you have issues around co-creation, co-design, and design thinking, which is often very much a process that people engage in, but again is very closely allied to a lot of work that is done in PPI. Public consultation, again, something that is not specific just to research, but is a much broader approach to take. Citizen science, where citizens or members of the public are gathering data on behalf of the project, and then participatory or participative action research or community action research, where the lines, even though it is a methodology, the lines between a participant and somebody who is a PPI contributor are much more blurred. So I think one thing that is often useful to remind people is that PPI is actually something that, while it might feel very new to some people, it is actually driven by certain beliefs. That some of those beliefs are things like those affected have the right to influence what is researched about them and how it is done, that the public using health services should have a say in prioritizing publicly funded health and medical research, and that this is about equity across the research cycle for those who have been excluded. And for anybody who's involved, let's say, in the disability sector, that the sea change of people with disabilities simply being the subjects of research and actually moving more into a role where they had a bit more agency completely changed the way in which disability research was done. It's always useful as well at this point to bring in some of the voices of PPI contributors. And I think that what is useful is that issue that comes up time and again, where researchers are concerned that the public or patients are only really interested in a cure for their particular condition. That hasn't been my experience in terms of dealing with PPI contributors. And somebody put a call out there last year and they said, well, would PPI contributors respond? Why do you do this? Why are you involved in this work? And this quote, I think, is very interesting. And anybody who is a scholar of Viktor Frankl and Man's Search for Meaning will probably see the same sentiments in here, that it is about making meaning from one's own life is what is driving and motivating people who want to be involved as PPI contributors. And that the other side to it is that sometimes people are very concerned that, well, you know, I have to do what they tell me. That oftentimes PPI contributors, if they have experience, they appreciate that this is about different kinds of knowing, different ways of knowing coming together in order to provide a richer picture. It isn't about one person dictating to another how something will go. And for this person, that they were identifying that, yes, it is important to have the science and research perspective. It is obviously important to have the clinical perspective as well, but that there is something to be gained from the knowledge and the lived experience and insights of people for whom, in this case, it's arthritis, who are affected by arthritis and the context in which they live. So what I'd like to do is I'd like to just very briefly talk about some of the supports that the PPI Ignite office itself provides. we've been busy, that we are now in phase 2. And over the last 10 months, we've done a number of trainings and workshops, we've done networking events, and we've done a number of face-to-face clinics, or Zoom to Zoom clinics, I suppose, to be more accurate about it. But that we are certainly working with individuals and research teams in order to develop ideas and to encourage things to move forward. In terms of what we are aiming to do at a Trinity level, we have 3 flagship impact projects that we have lined up that I'll talk to now in a moment. We will also be launching a small mentoring fund, and this will be a small piece of money in order to be able to start a relationship in advance of applying for any funding. We're hoping to get that off the ground this year, and so people will be able to apply this year. It's not a lot of money, but it is an opportunity to do things like rent a room, buy teas and coffees and things like that in order to kick off, hopefully, what will be a meaningful relationship. And the third thing that we're going to be doing is that we will hopefully be developing a PPI ethics module. I know this was something that was asked about when we put the call out to the different schools. They asked us about PPI ethics, and I'll certainly speak to that a little bit. But that this is an opportunity really to create something that'll be useful and usable across the country, because lots of people are dealing and grappling with PPI ethics themselves. In terms of the phase 2 flagship projects, the PPI contributor-led research, we're currently working with an NGO at the moment in order to work out a process whereby they can actually instigate an idea for a research project and then try to identify a researcher that would be willing to work with them to develop that. This, in some ways, this might sound terribly simple and straightforward, but basically we need to build up a contextual support infrastructure for that group so that they understand what's involved and they also understand the stakes as well. So we've started that. A second thing which became very clear at the beginning, and when Professor McCarron arrives, she'll speak to this directly, that the IDS Tilde itself has an awful lot of learning and knowledge embedded within it that we've never actually captured, and that there is a lot to be learned for the international community about the involvement of people with intellectual disabilities in PPI activity. So we are going to try and capture some of that over the course of phase 2. And the third thing that we'll be doing is we'll be looking at equality, diversity and inclusion within PPI and Trinity. And part of that is about trying to figure out who gets invited to the table, how do they get invited, what kinds of accommodations are necessary to make sure that there aren't barriers there, but how do people feel really included, that they feel actually like they're part of it, and that sometimes they can say things that might not be terribly popular and it won't be the end of the relationship. But ultimately, in terms of phase 2, our real role here in terms of Trinity is to build capacity. Phase 2 is a finite piece, and therefore we really need to make sure that capacity is built within Trinity by the time phase 2 finishes. So it is really about embedding the capacity for PPI within the schools, within the programs and within events, and that the PPI Ignite office, it's a finite resource. And so we want to encourage activity through us rather than from us as an office. And that by the end of the program, the functions of the office really should be absorbed into the infrastructure of Trinity, as they will hopefully be absorbed into all of the other infrastructures as well of the other universities. At a very basic level, one thing that we have done is we've created an online module, and it is an introduction to PPI. It also provides you with advice in terms of planning PPI in terms of a project, very useful for people who are putting an application together to the HRB or the IRC or SFI. And the third part then is about some of the practicalities of implementing PPI. It points you towards resources, and hopefully will be of help to people in terms of putting their applications together. We have also developed templates that would be helpful for you in terms of understanding your budget, in terms of planning your PPI, and also getting feedback. And we have created other resources as well. And I'll probably be coming back to some of these again, but they are also available on the PPI Ignite website. In terms of building relationships, one of the things, it is important that we are working with our colleagues here in Trinity, but it is also important that we are continuing to maintain and to build new relationships with other sectors outside of the institution so that we can create those kinds of introductions and make those kinds of links between people. So some of the things that we did in 2021, one thing is that we worked with Campus Engage on developing a really straightforward guide to running online workshops. Everybody's doing it. Everybody's asking, are we doing it right? This was an opportunity to try and capture some of that good practice. And that's available both on our website and up on the Campus Engage website. I was the principal facilitator for the IPOSI citizen jury on access to health information. And that was a really useful learning experience, but also something that really created a much stronger bond between IPOSI and Trinity in terms of doing that kind of citizen engagement work. And we also developed a workshop with Sphere, where the Sphere scholars who were engaged in PPI themselves had the opportunity to show the work that they're doing and to encourage their colleagues within Sphere to do that. So in terms of the time that I have, what I would like to focus on were some of the actual practical questions that people had for us in terms of PPI itself. And the questions that came in advance of this were how researchers can build their own networks, how to provide patient groups and research, how to involve patient groups and research charities, how to involve patients and publics from the beginning, particularly when you already have many years of experience, and what are the ethical implications to be considered. Now, I'll be able to share these slides afterwards, but very quickly, we'll try and tackle some of these questions. So the first one, in terms of building your own network, that it's not just patients and members of the public. Obviously, there are all kinds of different people who potentially can be involved in your research. And certainly Kate Morris, in terms of looking at engagement, would be looking at it in this context. As you can see, that the public, the general public, is very rarely general, and that oftentimes you are looking for subsections within any community in order to be able to engage them with your work, inform them about your work, let them know that you're here and that you are interested in being part of the world that they are already in. And that the thing is that these are not discrete categories, and that the public can drift in either towards public sector or can drift in towards civil society in the same way something like civil society can drift in towards business, let's say with social enterprises, or businesses can drift towards the public sector, let's say in terms of local authorities or strategic bodies. In terms of deciding who your stakeholders are, not all of your stakeholders are built the same. Some have very little power, and also what you're working on will have very little impact on them, and they would be the public. Some people will be very greatly impacted, but may not have an awful lot of power to change things. And that we would consider those to be helpful as indicators of things that are happening. There can be people with a lot of power to help and support what it is that you're doing, but that they're not especially impacted on it, and that these are influencers that really you should keep informed about what you're doing. But that the sweet spot really is for power brokers, and these are people who will be highly affected by the work that you do and also have a lot of power. Now, that power may be the power to fund you, it may be the power to support you, it may be the power to create change from your findings, it may be the power of having the ear of other patients. So this person doesn't yet necessarily need to have political power or economic power. They can also have other influential roles, and that it means that they can be in different places and they can have the ear of other people who can really make a difference in terms of your work. And that the reality is that there are different kinds of communities, and that what we're interested in is the community of interest, often in terms of the work that we are doing in health services. And that the community of interest can include funders, colleagues, clinicians, civil and public servants, politicians, advocates, research charities, but also PPI contributors. And I think one of the questions that researchers often struggle with is, well, how can I get to these people? How can I reach these types of people? And it can feel very intimidating. And certainly we've all been there in terms of feeling, well, how on earth can I get to politicians? How can I get to people in the Department of Health, in the Department of Transport? How can I get to these different people? And the reality is that humans, as humans often do, they come together, they coalesce around different things. So the places to find people are at things like public events. It is about finding them at public consultations. Charity AGMs are a great place to find people and to talk to people. Online events certainly have now become much more accessible and a much easier way to reach out to people around the country. Twitter, Facebook support groups as well continue to be places where people coalesce. And that I suppose there's always a question for me, for researchers, is do they know who you are? It's not about do you know who they are, but do they know you? Do the people that you want to engage with, do they know you yet? And if they don't know you, how can you be visible to them? And oftentimes how you are visible to them is by turning up. So either turning up online or turning up in a venue at an event, that's how you become known. And it's not, it might seem terribly straightforward, but actually that's how it starts. That's how relationships start, is that you actually have to physically turn up in order for people to get to know who you are, to build trust with you. And the second question was about involving patient groups and research charities. And thankfully, we have been doing a lot of work with Health Research Charities Ireland and their various members, who are all listed there on screen. And it has been a very useful way in which Trinity can make a link into all of these different charities. So somebody had mentioned that, well, you don't always know who to contact and you don't always know who the right person is. But if I look at these logos to me are: the Alzheimer's Society is Laura, the Fighting Blindness is Rachel. That these are people who have been building PPI capacity within their charities so that they can reach out to us and we can reach out to them. So they are there, they are ready to engage with researchers who are willing and ready to engage with them. They have experience, and that even if that feels very intimidating, then certainly the PPI Ignite office can help to make those introductions. And as I said, they have been here, we've invited them in here, so that the reciprocal can exist in terms of them coming out to you. We've also developed a toolkit with them about developing PPI relationships, and that is up on our website if that is useful to you. And just to remember that some charities are big, and that's the head office of the Irish Cancer Society, and that they have dedicated staff who will be able to work on PPI, that they'll have existing panels and national networks. They'll have a lot of insight due to the amount of people that they deal with. But other charities, this is what they look like. Their premises is a laptop, their equipment is a kitchen table. And that is, for some charities, that is as much as they have that you can see. But they are passionate advocates. They have access to people who you wouldn't be able to reach otherwise. They run on trust and personal relationships. They're often funded by the people involved, people who are literally both emotionally and financially invested in these small organizations. They're very grateful to researchers, but they are often really, really overcommitted. So if a researcher comes in and says, now, can you email or can you send a letter to all of your members? They're saying, I'm just about keeping things going here at this kitchen table. I am not your staff. So it is important to understand the type of charity that you're working with, what it is they need, where they're coming from, and how you can work in partnership with them for mutual benefits. And some of you will probably recognize this symbol because the Rare Disease Charities Day was there 2 weeks ago. Rare disease charities can be small, very small at kitchen tables, but can be international. It's the nature of rare diseases that there may only be 5 or 6 people in Ireland who have a particular condition, but they may be dealing with people in Singapore, they may be dealing with people in Ontario, they may be dealing with people in New Zealand. And obviously, as well, for some of the bigger and more prevalent conditions, then there are often European bodies that can provide a perspective as well. The third question was about early stage working with PPI contributors. And one really good example that we have is a piece of work that we did with Professor Louise Gallagher in the School of Medicine, and now in Maynooth University, Professor Lorna Lopez. And they developed this day with us where they brought together the autism community. Now, there's a very nice video, which I am not going to show, but suffice to say from it that what it did as an event is that it brought together a new generation of autism researchers with the community. It gave the community an insight into the latest on autism genomics. It provided space where people could come and help with offers of time and money. And it showed that Trinity was a good neighbor, a potential ally who was willing both to listen and to talk. Some of you might be familiar with the James Lind Alliance in the UK. They have a whole process in terms of how you involve people, and that you can see when you go on their website that possibly in the area that you're working on, that they've already actually run some activities with patients and members of the interested public to identify some of the priorities that people have. I can always appreciate that no research is ever starting from scratch, and that you are always building on what has gone before. It's also important to remember that PPI contributors are not telling researchers what to research. That agenda setting is about identifying what are the current priorities for PPI contributors, and that they can also begin a useful relationship in the way that the autism community did. Finally, what I'll do is I'll just very briefly mention about ethics. Ethics in terms of PPI contributors and PPI activity is still developing, if you like, that we are still in some ways codifying it. So it is useful to remember that the relationship with a PPI contributor is different from a relationship with a participant, and therefore it can often be more in-depth and can have a certain lack of clarity at the beginning in terms of what's involved and what the responsibilities are. And there can also be issues around recognition and acknowledgement and IP. PPI Ignite and Trinity within PPI Ignite, we have been working on a values framework, and we will certainly be happy to share that as it develops. But we are trying to identify what are the values and what are the principles that should be driving PPI in Ireland. So it's useful to remember that PPI can often be iterative, and that it doesn't necessarily lend itself to a predefined protocol. So how do we ensure that research teams act ethically? Who's best placed to review the work, and what responsibilities as well does Trinity have in this context? Now, we did a piece of work with the Alzheimer's Society with their Dementia Research Advisory team, where we actually worked out a terms of reference or a memorandum of understanding so that anybody who wants to work with them understands what are the things that they want and how do they want them. This is not impossible to do. It's actually quite straightforward. People often are very clear about what they want, and that is a good start to it. As always, I'd just like to acknowledge our funders, the HRB and the Irish Research Council, and also Trinity College, who have co-funded this, the Dean of Research, the Office of Dean of Health Sciences, and the School of Nursing and Midwifery. So I am going to stop sharing from there, and I will invite my colleague from the IUA, Kate Morris, to come on screen.
That was a brilliant presentation, fascinating content, and just really a little word of thanks to our colleagues across Trinity College Dublin, who really provide super leadership, intellectual insight, and a kind of a passion to drive this agenda forward. I've now been working with you for a number of years, including Michael. So just acknowledge that from the outset. Of course, Mary's work as well is recognised very much within the IUA. So more or less, I've been invited here today to give a kind of a, for want of a better term, a macro perspective on what is happening in this space in terms of the Irish Universities Association. And who are the Irish Universities Association? Well, we're basically a membership organisation where the council, which is the presidents of each of the universities, the 8 universities, including TU Dublin now, come together to strategise, to try and peek around corners and plan for practice policy change to make sure that our universities are fit for purpose and are ahead of the curve. So I am working now close to 8 years plus with a number of my colleagues, including Sarah Bowman, who's led out with myself on the specific area of engaged research and innovation for societal impact. And we have worked with a very effective working group with national representation. So bringing together at a kind of an Ireland Inc. level expertise, insight, tacit knowledge to build out tools, resources, training to support change on the ground. So a brief history of Campus Engage and our raison d'etre. We came together in 2014, again, with partners from across the institutions and other stakeholders to craft a charter that each of the presidents would sign to properly embed engaged research and innovation as day-to-day business across the universities. And this is them all together here in 2014, and they all signed 10-foot perspex a charter committing resource and prioritising engaged research and innovation across the institutions. So we have a kind of a network of units, for want of a better term, across the institutions who meet regularly and exchange knowledge and insight and ultimately help us support to better implement very high level policy, all these lovely, beautifully written documents that government agencies or institutions prepare and draft. What we're about is picking them apart and working to implement the how-to piece of policy for practice change on the ground. So looking at this matrix of policy and practice change, of course, for 2022, going left to right, we know now that the Department for Further Higher Education is in the process of drafting their next research and innovation strategy. And what we do at the IUA is we try to meet those people who are drafting to communicate key messages about what's happening at a European level, what's happening at institutional level, an opportunity for Ireland to really excel in specific areas like engaged research and innovation. They're also drafting a education for sustainable development strategy, which we have been consulting on and trying to engage with. We also know at a European Horizon Europe level, which I'll go into a little detail, is that Pillar 2 specifically is very focused in on engagement across the research innovation life cycle for societal impact. And it's hanging its hat on the UN SDGs to try and demonstrate how we are implementing the UN SDGs through research and innovation, a complex job which we're trying to wrap our heads around and build expertise and skills through teaching and learning and training, which I'll talk about in a moment. As toxic as they are, the Times Higher ranking now ranks institutions on societal impact across the UN SDGs. And as I mentioned further on, all of our funding agencies now bring in this engaged research for societal impact in some shape or form. So Michael has asked me here to give a kind of a 101 on how we are working at a national level, at an interagency, interdepartmental, sectoral level to build capacity across Ireland for engaged research and innovation to deliver impact on the ground. And we're broadening out our concept of impact beyond tech transfer to much broader concept of societal engagement, of course, health, well-being, environmental, internationalization, arts, culture, heritage, and I'll touch on this. I'm sure Sarah, I understand Sarah has given a fairly decent presentation on planning for societal impact. So this is how we're really building skills across the sectors I'm going to talk about. So my role within the IUA, I'm working with the HEA, with the Department of Further Higher Education, Research, Science and Innovation to plan how we can do this on the ground. So we've got 4 core areas of where my attention is being directed for the coming years. The first is how we better create research for societal impact frameworks and key performance indicators, and how we can better explain to the public, to the Department of Public Expenditure, how important it is to invest in research, because it really does make change on the ground. And changes people's lives, as we can see from the work of PPI specifically. My other focus is going to be collectively with all of our colleagues is how we better enable and facilitate evidence for public policy. So there's a new unit now within the Department for Further Higher Education specifically set up to better enable and facilitate more research to inform public policy and how we better implement public policy as well. A huge amount of work happening across Ireland and across the universities in that space. Lots coming out of Trinity College. Third, which is what I'm going to talk about very briefly now today, is how we scale capacity, how we build our researchers, our innovators' capacity, and of course teaching and learning staff, because we would look at this across the spectrum and that early intervention point of how you're teaching students how to engage with research stakeholders from the very get-go across a project or piece of research. So I'll crack on. And briefly, we've been at this, as I mentioned, for a number of years. Really, in 2016, we set about carrying out an international evidence review. We consulted with over 300 stakeholders and critiqued and analysed 300 comments from surveys, and built out an engaged research framework and an engaged research practice and principles, and a framework on how to plan for societal impact. And from this, Enterprise Ireland and the European, as it was, Horizon Europe or Horizon 2020 colleagues in Enterprise Ireland approached us, Imelda Lampkin, and asked us to convert this into a training programme and to train the national contact points across the Horizon 2020 Academy in engaged research and planning for impact. So we did that in 2018, and that was led out by Sarah Bowman and myself. And following on from that, we had a brokerage event trying to bring all of our research stakeholders into a room to better create partnerships, which is something we really want to do more of into the future. And we've been working closely with our colleagues across the funding agencies and to embed this practice at local level. So that's just a process for building, for really validating our frameworks, validating our definitions. And our ambition is really to create a national agreement on what engaged research is, that's with our department, our funding agencies, our policymakers, our practitioners, and to illustrate that engaged research is a strength on the island of Ireland, and it's kind of like our unique selling point at a European level, that this is something we do and we do well. And we want to build our profile and increase recognition of the level of expertise in this space in Ireland, and to develop awareness with researchers of opportunities, what works, what doesn't work in engaged research, and basically really to leverage campus engaged people, the people associated with this work, as a national asset, and to profile excellence across the system. So Michael has talked a lot about PPI, and we look at engaged research as this kind of umbrella term. So it describes a wide range of research, rigorous research approaches and methodologies that share a common interest in collaboration with societal partners. Where the process is looking to improve, understand, or investigate an issue of public interest, including societal challenges. And we know that there's a lot more funding going to be going into societal challenges, whether that's through the SFI, IRC, postdoctoral PhD positions, and so on in the coming years. So ultimately, it's about advancing with societal partners a societal challenge with them rather than for them or about them. And we talk about societal partners or community partners. We mean service users, product users, policymakers, civic society organization, industry partners working for the public good, members of public and others. And the terminology, again, just to echo what Michael is saying, I hope here, so engagement really refers to about the building, so refers to the effort aimed at building relationships, raising awareness, and other activities focusing on exchanging and mobilizing knowledge. Involvement is about co-created, co-produced research with the focus on collaboration across the research lifecycle, and participation, depending on which definitions you're reading, refer to the recruitment for things like studies, longitudinal studies, and other research studies, randomized control trials, whatnot. So our focus again has been on building partnerships for systems change. And we talk about systems change, we mean policymakers, funding agencies, research practice, institutional exec level, and also at a society level. So we've built relationships with the HEA and PIA, our colleagues in the European Commission, SFI, ERC, and other agencies. We also have, for this building capacity program, we have a project advisory group. And again, it's trying to bring in the insight from the policy making, the funding agency, and the practitioners' perspectives, and also from those who manage community-based or charity-based engaged research opportunities, such as, and that includes Avril is also working with us on this advisory group. So we have we built out and we're building out a really high quality 6-week online course. And that is 30 learner hours, and it's going on from the 21st of March to the 6th of May. So it's about self-paced learning. It's about doing activities to step back a moment, if I can, really what the challenge we're trying to address here is we have at a national level 3-4 really expert engaged research, societal impact experts who can deliver this training. And what we need to do now for Ireland is rapidly increase the number of those trainers or those facilitators. So this training program is built exactly to do that. It's a train the trainer program and includes peer-to-peer learning and very in-depth case study analysis on what's working at a sectoral level, what's not working. So it's week by week topics such as what is engaged research, innovation for societal impact, what are the methods, how do we better realize research impact, how do we mobilize research for public policy, how do we monitor, assess, and communicate out research outcomes. And then we have 1 week engaged research facilitator training, which Michael Foley, we are delighted to say, is going to be driving with us. And he's also going to be engaging in that expert facilitator mode across weeks 1 to 6. So again, focusing in here on what works from across the system. We had a wonderful bottom-up driven, really authentically documentary series on RTE called Changemakers. And we're going to be using case studies from that series, but also other case studies coming from departments, whether Department of Justice, Department of Housing. So the course is very much focusing in on exemplars of really good practice and very much openly discussing what does work and what does not work in engaged research and planning for societal impact. We had a launch the other week, 24th of January. We brought in the Director of Horizon Europe Ireland to talk about his perspective from what Europe wants. We also very much focused in on the core funding agencies and opportunity to draw down funding to do this type of work. Our target audience for the training is It's really the researchers on the ground, research support staff on the ground, also inviting in policymakers and those from community, other organisations outside of the immediate university Department of Further Higher Ed ecosystem. So we had a very challenging experience of trying to weight all of these. We had 140 applicants, which is quite a high number, seeing that they had to get a level of support from the director of the institute and write their own letter of ambition, why they want to do it, and some level of experience in the space. So a lot of detail and drawing through applications. So we now have 30 representatives from across the system, including universities and the new technological universities and the SFI centres and others, SEAI and the Wheel and others involved there also. So the weekly course, the content is all about reading with slides, so knowledge transmission, watching case studies, reading latest documentation, mainly grey literature and some academic literature, peer-to-peer learning to discuss how to become the trainer for your institution, reflection, and then on a Friday, there is this What Works focus webinar with case studies looking at what is happening across the ecosystem. So the real pitch here is that we rapidly scale the number of facilitators for Ireland to do this work, this type of research. So each facilitator that comes and takes the training is committed then to delivering a workshop within their institution or their organization, their research leading organization. So the idea here is that between kickoff or end of course and 12 months time, you could have a potential 900 plus research collaborators and support staff trained. Very much embedded in the course is all of the latest literature, all of the latest opportunity and the core criteria for engaged research and innovation. So that includes the SFI, HRB, Horizon Europe, EPA, the Royal Irish Academy, who is excuse me, looking to launch a youth academy soon. That's their intention. It's on their work program for this year and next, and others. So we're in the process of updating our existing how-to guides, going out to practitioners, asking them to review, going to the funding agencies, also asking them to review and update content with us. So again, very much a collaborative process to make sure these are fit for purpose and on point. So there's much opportunity out there for this type of transdisciplinary, engaged, collaborative work. So Irish Research Council, again, they have their PPI network, Ignite network, but they also have calls around New Foundation. They have the new Dorothy Research Fellows, which is fellowship which they've just recently launched. I'm sitting on their steering committee for that, the Coalesce call and others. And in addition, we know that the Science Foundation Ireland has a number of opportunities, and the SFI research centres themselves have core criteria and KPIs for engaged research, but also the new SFI Challenge funding call programme. There's 70+ million going into that. SFI strategic partnerships and other supports. And of course, Horizon Europe, this is deeply embedded in the Horizon Europe agenda and the framework FP9, working closely also in addition to these kind of top-down 5 challenge-based mission calls, Conquering Cancer, Climate Resilient Europe, the mission for our oceans and waters, 100 climate neutral cities by 2030, Caring for Soil is Caring for Life. These missions are very much the core criteria. You cannot even begin to be considered as an applicant unless you're bringing in the policymakers, citizens, public, patients into the research project application and how you're going to deliver the research project over its life cycle. We also know that there's other funding agency work out there, the Rethink Ireland, Enterprise Ireland Disruptive Technologies Fund, all bring in this core concept of engaged research to better deliver societal impact. Pardon me. And I know Sarah will have tipped on this a bit, but we're updating our existing Engage Research for Societal Impact framework. We have to incorporate all of this newer literature, such as what the SFI have now produced and our public service reform agenda, which really aligns with the evidence for public policy remit of the new department and future funding calls. And of course, always embedding the art humanities across our frameworks as well, and understanding that now art humanities social scientists need to be embedded in funding calls, in addition to that pillar 2 of the Horizon Europe pillar 2 agenda. So a lot more on that in the detailed course. So I won't go on. I think I've probably covered all the basics, but I'm also advising the European Research Council. I know we might have a couple of Trinity Research Council awardees in the audience, possibly, because you do rate very well in that department. But this is top down. These a lot of the pillar 2 piece on challenges, but also this very much relates to the Blue Skies research and the European Research Council agenda. In addition, but just a quick slide here on how Horizon Europe is going to be weighting and assessing the impact of research from the framework FP9. So they've broken into really 3 categories, and that's the scientific impact, or new knowledge, we like to call it, societal impact, ecological or economic and technological impact, and they are going to be monitoring longitudinally how this research is delivering and implementing on the UN SDGs, aligned with a European and adjusted indicators for Europe, and a monitoring tool that weights and indexes in countries across what they're doing to implement the UN SDGs. So lots of work there for the Commission to do on how to get that right. But if you would like to follow us, I would really suggest that there's 2 ways you can do it. There's one, you can sign up to our database, and the other is that you can follow us on campus _engage for Twitter. And also feel free to email me at kate.morris@campusengage.ie. So maybe the core theme here, or the messages, there's a beautiful African saying or a proverb, which is, if you want to go fast, go alone. If you want to go far, go together. And that is the key theme here, is really about we're doing these things in collaboration to make sure of the kind of systems change and addressing that kind of permafrost or perma-ice that exists in some institutions. So I hope I'm on time, Michael, and that was a fair enough kind of 101.
Okay, thank you very much. And I'm just going to follow on, and apologies I wasn't here for the start of the event, but I had another event that I needed to go to. So I'm just going to share a little bit about my own experience. My name is Professor Mary McCarron, and I'm the PI of the phase 2 of the PPI IGNITE program, and I also led phase 1 here at Trinity. Kate has spoken there a bit about, and also Michael, about PPI and its relevance for researchers and academics. And Kate has alluded to this, but it's extremely relevant for all of us who are involved in this space. So where it is appearing? It's appearing in national policy. It's appearing, as Kate said, in the health research strategy, the European funding strategy, the requirements for designation. So you look at the new Cancer Institute, the consent declaration requirements, the health research partnerships. So it's appearing everywhere. So it is our business, and we've got to, I suppose, try to get up to speed with it, and we've got to try to understand it better. So embedding PPI then within Trinity, and there has been a number of efforts over the last number of years to do this. So we see it in our strategic plan, in the research charter, the Living Research Excellence strategy, and in the School of Medicine research strategy, and indeed in other school strategies as well. So we need to understand how new forms of engaged research and research co-creation can really drive discovery. And I think if we're not in that space going forward, it's going to be extremely difficult for us as researchers to firstly even gain funding, but to really understand the relevance and impact of our work. So I know at embedding PPI at a strategic level, and I certainly, when I was Dean of the Faculty of Health Sciences, we spent a lot of time looking at the criteria in terms of how we could embed it even within promotions criteria, and where was the opportunity to do this. And in the essence of time, I'm not going to go into this, but in great detail. But within the research support system now, there is an opportunity for you to tick this box in terms of the engaged research profile. And I think for academics, that is extremely important, because to really be involved in engaged research and to take it in a meaningful way, and I've done it for most of my career, unless you really spend the time at it, and it does take time and effort, and people aren't rewarded for it in terms of academic promotions, etc., it would be very difficult for people really to do the work that's involved and this necessitates. So PPI in my own research, and I'm just going to speak to you a little bit about my own research. So I'm the PI of IDS TILDA, which is the longitudinal study in aging in people with intellectual disability. And this is a map here of the world, and all of these dots here are countries that have been involved in longitudinal studies. And the two little happy people in the centre is IDS TILDA. Because when Ireland was launching TILDA, which has been led by Professor Roseanne Kenny, I was very concerned that people with an intellectual disability had never been included previously in any study in the world on ageing. And yet they were dying about 20 years younger than the general population. So I was on a mission. And while I was on that mission, I decided for the first group of people, before I had any money or anything else, that I needed to get a coalition of the willing together. And I worked very hard with people right across the country. I sent out a call to people with intellectual disability randomly to submit pictures of what aging meant to them and a small narrative of what that meant. And imagine I did think back in 2006 to put in a small consent form so I could actually use that piece that they had put in. And we went around, used this, we got 250 photographs submitted over a 2-week period. And I struck off with my team all around the country, and we held a photographic expedition at the Ploughing Festival, the Fringe Festival, and all of these festivals, where we garnered people with ID who were living in those communities to come out and to celebrate that they were also a member of a society, and we needed to celebrate their ageing. And we are now out in the field for the 5th wave. So we started off with austerity custard cream biscuits and the coalition of the willing, and we now really very successful funded research program, and we are moving into our 5th wave, which will be 15 years later. And this didn't happen. When I set out at the beginning, I was very intentional about impact. So I was very thoughtful about impact from the get-go. And I thought it through with people with intellectual disability. So long before anyone, I knew that there was such a thing as PPI. We had a very sound conceptual framework underpinning IDS TILDA, which you need for good data and good research and good science. But we also had a very strong values framework, which underpinned the study. So if you go back to our first publications in 2006, you'll see this values framework. And it's as relevant today, I think, as it is when we really started to do this work. And this is around inclusion, promoting best practice, being person-centered, empowerment, choice, and respect, all of those things. And this is why I do it. So people now with intellectual disability, the input right across the life cycle in ways that's appropriate to their skills, their interests, and their effectiveness. And one of the things that I, really wanted to be careful of, that we weren't just paternalistic, tokenistic, and just bringing people with an intellectual disability to the table to tick a box and to say that we were there. And I think that's just so critical for us. And if you're going to involve different populations, you need to see how you can empower them to involve. And this is some of our participants here co-designing our protocols, and we use easy read materials in a voting system, whether they felt things were relevant or not relevant. They're members of our steering committee. Some of our participants are now with intellectual disability are involved in the training of our field workers. Nilin Yap, who is working with us, a lady with a young woman with Down syndrome, she created a 15-minute small video film for us, Aging with Pride, which speaks to the 10 years of the data from IDS TILDA and helps to give it in a really accessible format to people. And then, of course, a big effort on the translation. Yes, it is about producing good data, but what difference would this data really mean to the quality of life, and how can we get this data to impact on health services. And we've just recently published this paper on retention and recruitment. And really what was really interesting, when I was dreamt about this study all back in the 2004, 2005, people said people with an intellectual disability wouldn't be able to be involved. It would be just much too difficult. And we have had almost an 87% retention rate over the lifetime of the study. And again, that didn't happen by accident. That happened because we made a real effort to make sure that this study was meaningful to people with an intellectual disability, and that we could see its usefulness and that they were involved. So I think that's really useful. And Mei Lin Yap now is working with us as our ambassador liaison officer to the project and to the centre. And what Mei Lin has to say is you have given me a voice to advocate for people like me. And I just came back from presenting to the Oireachtas Committee on brain health, and I had Mei Lin Yap with me, who was there, and I think that's really what's important. So engage research for societal impact. So I was very interested, for instance, IDS Tilde data and other data was shown that I had been involved in longitudinal studies for many years, and we were very concerned about the high risk of Alzheimer's disease in people with Down syndrome. So one of the most critical things for me, and I did my PhD in this area back in 2002, I finished. And one of the most critical things for me was, we all were talking about the genetic risk factors for Alzheimer's disease in this population. And my big question to the field was, what does it mean for care? How can we get it into dementia strategy that will really change care for people with intellectual disability? And as you can see, these couple of lines here that went into that dementia strategy when it was published all those years back. And it was me working with government and making sure that the voice of people, because when the strategy is published, the train has left the station and it's too late. So if we can't get the research in and the data to influence policy at this level, when the policy is published, we have missed the opportunity. And I spend a lot of time building partnerships. And this is a group of people here. We, with 60 members from the Voluntary Bodies Association or Federation of Voluntary Bodies, it's an umbrella group. And after each wave of IDS Tilde, we sat down and we looked at what were the key findings, what was the emerging things that we really should address over the next 3-year cycle. And that particular group in 2017, we felt that for people with Down syndrome, we knew that there was huge problems with them accessing timely assessment for memory concerns. That despite the fact that the world's largest genetically predisposed population to develop Alzheimer's disease, with about 80% of them developing dementia when they're over 65 years and a mean age of onset of 50, most of them could not access a memory service. While we had some good pockets of services in some of the intellectual disability organisations, they only serve people within their organisation. So if you weren't attached, you were outside the door. General memory services felt they didn't have the expertise, and they were really, we were talking about people, the mean age of onset, as I said, was 50 years. So we were looking at a much earlier age of onset. So I continued to build this momentum. I convened clinicians, international academics and researchers and PPI contributors, and held a massive State of the Science symposium here at Trinity at our campus at St. James's. And in 2020, I secured funding to the Dormant Account Funds to establish a pilot national intellectual disability memory service. So since I was faculty dean, I'm still waiting to take my leave of absence, and when I stop working so hard, hopefully I'll get time to do that. And I got some seed funding to set up a memory clinic, and my colleague, Professor Sean Kennelly, is the clinical director, and I'm brought out 1 day a week to serve as the clinical director of this. And I'm really pleased to say we established this in conjunction with Tala University Hospital, Trinity College, that's Orla, our previous Dean of the Faculty, and Avista, which is an intellectual disability service, who had extensive experience in running a memory service for people with intellectual disability. And we needed to fuse the knowledge and the expertise across those 3 areas. Trinity coming with a very strong, a lot of experience and the research end and the science end, Tala with its experience in running a generic memory clinic, and a Vista with experience in intellectual disability. And I'm really pleased to say that I put in a bid to the estimates last summer, and we have got sustained funding now for the National Intellectual Disability Memory Clinic, and we are just appointing the team, and as well funding to extend this to develop satellite centres throughout the country. And we'll be employing, we have 2 advanced nurse practitioners now appointed at the Tallaght site. We're appointing 2 down the country, psychologists, OTs, speech and language, etc., etc. So that is a really good success story, and that we have now can address this huge inequity that was there for so many years for this population. So all I can say to you is, you know, if you have the sustained effort, work with key stakeholders, you can really make systemic change at the policy level. And this is us here again, you know, working with people with intellectual disability. Even when we got the funding, we still are continuing to work very closely with intellectual disability to help us build their memory service and what that should look like and how they should have a say. And we have developed a very big suite of key performance indicators as well that we will be used to evaluate this. And PPI, of course, remains a very strong component of the overall memory service. And my colleague, Dr. Eamon McGlinchey, has developed what's called the Brain Buzzers Club. And this is a club about brain health, and will also act as a PPI panel to advise on the perspective from the intellectual disability community about the ongoing developments of the National Intellectual Disability Memory Clinic. So from the very beginning to the very end, people are very much there. So that's a little bit of the story, and it just shows with that very strong community engagement, that strong connection at the very beginning, I suppose, where that journey is taken to. And now, of course, we have a responsibility in terms of, Michael will have spoken about PPI phase 1 and where we are moving to in the field with now phase 2. I was very pleased to accept on behalf of my own team the HRB Impact Award in 2019, and I think it was well deserved. And we had a large number of partners during the first phase of the PPI Ignite program, and you can see these all listed here. And these were the partner council projects and funding and in-kind support and numerous projects that we ran with various groups across the country at that time. And now for phase 2, which is a huge other body of work which we are involved in, and the network has been recently launched, and Michael is a program manager for that, and thank you, Michael, for doing the sterling work that you do in keeping all of that running, and of course we're working closely with Mail-In Yap. And this here is the network partners that are involved in the phase 2 of the Ignite program, and you can see here a wide variety of partners from right across the country and organisations. And the benefits of having a national network, and why did we feel it was necessary to move to a national network? Well, I think we were all doing across the institutions and across the NGOs and various groups, and Kate has spoken about the fantastic and sterling work of Campus Engage. It was really to bring a lot of this work together and stop a lot of the duplication as well at times that we were doing across the universities and across the sector. So we're going to have something like a national PPI festival, but having a national PPI hub where we can all feed in with all of these resources, produce stuff only once, and there is a home for all of this work. And a colleague, Dr. Sean Janine in Galway, is leading this. A host of community outreach projects, publicising partner events, so there's value for us all, and the PPI National Network Office can do a lot of the heavy lifting and help us all to publicise our work. We can develop national positions on various issues and promoting Ireland's PPI work internationally. So the responsibility that we have and that I'm leading here at Trinity is there is various work packages within phase 2 of PPI Ignite programme, and the package that we are leading is on how to improve the quality of PPI in Ireland and how to build a culture of impact assessment in PPI. And we have spent the last number of the last year really trying to really, I think I started off IDS Tilda with a very solid values framework. And when we were starting this work, we felt getting the values, and Michael has presented those, that will really underpin what we mean by good PPI work was really, really important. And after we get the values right, and we decide this is exactly what they are going to be, then we can develop a framework then to help us understand, well, are we really living these values? And that we'll have good criteria where we can actually assess, or anyone else can come in from the outside and assess how we're actually doing. So for phase 2, the Trinity Partner Council includes colleagues from Tilda, GBHI, my own group at IDS Tilda and TCID, Professor Louise Gallagher, Dr. Deirdre Daly, Dr. Vincent Sheehan, Amanda Kine, Catherine Darker, and Professor Linda Hogan. So they are the group now from Trinity who's part of the Partner Council who's helping us to do this work. And I think, you know, just to conclude, because I'm concerned over the time, you know, I think these are some of the challenges that I see, that we do need to enhance metrics to award in-depth PPI. And this really is going to involve changes for engaged research in HR practices. So there are certain things that will need to change in order to make that happen. So when you look at the criteria for academic promotions, is there anything there that really academics can be rewarded for the level of PPI work that they're doing? I'm really quite concerned about that. And that needs to be very clear and explicit. And we need to educate, and I know Kate is doing a lot of really good work around this, but we need to educate people on how to evaluate. So when I see funding applications, and I review in a lot of funding panels, I can immediately look for the PPI section and see, well, how well is that actually done? Improving budget and financial processes. So, for instance, if we want to pay people who have been engaged in PPI, you know, is there a process within the universities that we can pay people? And this is often very challenging and very difficult for people who have given up their time for us to do this. We need to integrate PPI skills into curriculum and training. Like, I would like to think in the future that we're all very familiar with the ethical processes that are required to undertake research. And we spend a lot of time educating our students around this and training our students in good ethical principles. I would like to think that in the future, PPI will have the same weight and value within our programs, and that will be just as natural as it is now for most people to understand the need for ethical principles and ethical processes when carrying out health research. And creating accessible spaces for PPI work. So if you're bringing these panels together, like in health sciences and in every other faculty in the university, we're scrambling for space or a meeting room or something that you can bring people in to engage in this work. And ensuring institutional recognition, as I said, for PPI contributors, and engaging PPI activity with ethical review, and developing communication plans for PPI activity. So they are some of the challenges that I see at the university level and at the faculty level that we need to start to really address in order to change the culture, because this really does involve a fundamental culture shift and culture change, and it will involve changes in some of our well-established processes in order for this to happen. I think in Trinity, Trinity has begun that culture change, and I showed you where it's embedded in strategy, and we must now ensure particularly that junior academics are recognised, facilitated and rewarded for embracing PPI. Thank you.
We're delighted to have Owen Potter from GBHI, Patricia Doherty and Catherine Buckley from the Cancer Institute, Beck Hanley, who is a colleague from the UK who has many years of experience in PPI, and Professor Deirdre Daly, who is the PI of the NAMI study, as well as an associate professor in the School of Nursing and Midwifery. It would be really great to get some ideas from you, both Patricia and Owen. You're both in institutions that have really needed to embrace the patient voice in terms of PPI. So Owen, if I could come to you first in order to get a sense of how you've done this and how it's worked.
Thanks, Michael. Yeah, I'm happy to speak to that.
Sorry.
GBHI, obviously, the core reason why GBHI exists is to take a kind of a global and brain health informed approach to kind of improving the lives of people with dementia and their families worldwide. So from a kind of a mission point of view, not including, and it was always kind of written into our plan to some extent to really include the lived experience of people with a diagnosis and their family in what we did, but how that was kind of actualized was less distinct. So with lead of Irasima Larai, we applied for internal funding to build this more into what we do, to effectively bring PPI right into the center of what we do, to kind of, and one of the big pieces of core business GBHI does is the fellowship, the Atlantic Fellows for Equity and Brain Health, which is a global interdisciplinary program. So the kind of first order of business was to try and get PPV or PPI training into the program itself. And Michael and PPI Ignite were really, really helpful with that. The second order of business was to kind of create the actual panel itself. And there was a pre-existing panel with our consortium partners in UCSF, which we managed to augment with through collaboration with ASI here, and also bringing at-risk people in from another research study that was ongoing. And that's really been something that has kind of developed massively over the last year. We have 17 members, and they are beginning to get more involved in advising on and consulting on research, but also kind of co-developing training for the fellows and the staff. So that's really becoming embedded. And the latter thing that's going on, and this is what I think is really, really exciting, is that we're starting to develop with our alumni are very much a part of our mission. So we kind of keep very close contact with them, and they form a group of what we call senior fellows. So the senior fellows have really, really bought into PPI as an idea, and that they are starting to develop kind of a global toolkit, a global approach for PPI. And when you think that a lot of these people are coming from countries where, let's say, the medical profession is very hierarchical and relationships with the general public are very, very hierarchical, or there's a lot of stigma around dementia or neurodegenerative disorders or diseases, that the idea of bringing the voice of the person into informed research and service development is really kind of revolutionary. So that's very exciting. So that's kind of how we've approached it in terms of both our institute and our mission. A lot more work to do, but we're making progress.
Thanks, Owen. And there's a little bit of howl around here. So Patricia, can I bring you in on that as well?
Yeah, absolutely. And thanks for having me, Michael. So as you know, the Trinity St. James's Cancer Institute kind of embarked on its journey with OECI accreditation, which is the Organization of European Cancer Institutes. So that's the only European body that's involved in accrediting cancer institutes. And I suppose its main objective really is to ensure that cancer care and cancer services are all consistently patient-centered and patient-focused, and that's across research and education as well as the clinical areas. And so when they come to assess a cancer centre, they look at governance, they look at the organisational quality systems, they look at multidisciplinarity of care, prevention, detection, all modalities of diagnosis, treatment and care. They look at translational, basic and clinical research. And they look at all of the education and training programs, and pertinent to today in particular, they look at a patient assessment and involvement integrated across all of those areas. And so, you know, they look at patient education programs, they look at patients' rights, they look at how the centre is collecting information on patient satisfaction and patient experience, complaints. They want to see collaborations with patient organisations. And so I suppose from our journey's perspective, what had happened was St. James's Hospital had its own patient representative group for quite a while, and they were involved in a lot of clinical service questions and that kind of focus on quality aspects. And so when the OECI team came to assess us, we engaged with the overall hospital patient group, which had some cancer patients on it, but they weren't all cancer patients. And so one of the key recommendations for us from the site visit was to develop our own patient representative groups. And I know I'll bring Catherine in on that in a moment, but that kind of guided our development in that way, which was incredibly useful as part of the process. And also one of the remits of the overall group wasn't necessarily into, reviewing research proposals and research ideas at an early stage, which is something that we're developing now with the PRG, which is just so invaluable, as some of the other speakers have touched on, the way the funders are going with PPI requirements now, which is fantastic. But one of the other areas that it has kind of guided us with as well is that they do look for patient involvement on board level and executive committee level. So it's in all of those areas that the whole accreditation process has really been shaping how the Trinity St. James's Cancer Institute is progressing. So I suppose I'm not sure if Catherine would like to step in and talk about the development of the PRG, or Michael, if you want to direct it another way.
That would be great, Catherine. Yeah.
Hi, Michael. Thanks for having me here this afternoon. So I took over this role in September, and the PRG is part of my role in quality. So there is a patient representative group of 9 patients. They either have had cancer or have cared for somebody with cancer. So again, their remit is right across the Cancer Institute, not just research. But I did notice that we were actually possibly having 3 requests at each meeting for PPI. So we kind of had to look at how do we best get value out of that really, really, precious time, and to get the best for the patients and to get the best for the researcher. So we have a 2-hour meeting every month. So we've now allowed 2 researchers to each meeting. But what we're asking them to do now to get value from patient representative group is to actually fill out a summary form. So the patients actually developed a form that actually pinpoints what exactly they want to know from the presentation. So I presume that actually helps the researcher as well, because it just kind of allays their nervousness, joining the group. It gives the patients time to actually look at the proposal, and actually then they can jot down any questions they have. And then at the presentation, at the next meeting, they listen to the presentation and they give their feedback. So we started this intervention 2 months ago, and it seems to be working quite well up to now. And what we've also decided to do is actually close the loop and actually give a proper report back to the researcher as well, so that it is very obvious that they've come to the group, and also the fact that the group members are part of a governance structure. One of the questions actually that the group ask is, what support do you require from the patient representative group? So because they're in part of the governance structure, it actually really, really helps, because anything that is an issue actually can be brought up through the Institute. So it's really, really, it's work in progress, and very interesting. So, yeah.
Great, thanks very much for that, Catherine. Actually, Deirdre, can I bring you in on this then? Because the PPI approach that you've taken in the MAMI study is quite different, but it's still very much responding to the needs of the women.
So thanks, Michael. And again, like everybody else, it's great to be here. So yeah, I set up the MAMI study for my PhD in 2011. And from the very start, I suppose, the MAMI study is a longitudinal study looking at the health and health problems experienced by women as they move through pregnancy and motherhood. And it's asking women an awful lot of sensitive, intimate information. The surveys are very long, somewhere between 60 plus and 80 pages long. And one of the challenges is, would women who are transitioning to motherhood be interested in or having the time to fill them in? So I started at the very beginning with literally consulting women and won the surveys and say, look, is it needed? Would you complete it? And the resounding response from the group of women that I spoke to was, bring it on. And that was hugely confidence inspiring, because I was able to go to ethics then at a really practical level, and people say to me, women won't have the time to fill it out. And you're able to say, well, actually, they said they would, and they said they wanted it. And then along the way, Michael, we very much evolved then from that whole consultation to real genuine partnership. So women co-developed the second baby follow-up study, the 5-year follow-up study, and they're now about to co-develop the 10-year follow-up study with us. Fantastic. But they did other really, really practical things along the way that would have been impossible without them. For example, when we were approaching second time, women who were having their second baby, it was going to be opt-in. So how do you approach someone who is either traumatized from a first birth and is never going to have another baby, dying to have a second baby but can't get pregnant? And what language do you use and how do you get all of that? Women designed that for us. They designed it with us. That was brilliant. The other thing is, if a woman wrote in one of the surveys then that she was struggling or had issues or was been beaten or slapped at home, what are you going to do to offer support? So it was the women that said, look, women are intelligent. Why don't you put sources of support and self-help leaflets in? They went into all of the surveys at every time point, and women loved them, loved them. Then it developed, and I think it's very much, I very much support and feel the same what Mary said, the same as what Mary said about the values. I mean, if you really believe that the research we're doing is we're collecting women's stories, it's their stories, their information, and all along the way, what we've tried to do is tell them what they have told us collectively. And that in itself has been hugely empowering and has driven other sub-studies, and every step of the way reinforced it for me that you can't, it's all of us together to make it better. So it's been hugely inspirational, and they have co-presented at conferences with us. They've presented at their own at conferences, national and international. They've done TV shows with us, radio shows with us, and without a shadow of doubt, they get far, far more traction and kudos than anything we could have done on our own.
That's great. Thanks very much, Deirdre. And Beck, can I bring you in here? Because one of the questions that comes up time and again, and I know you have a lot of experience in this area, is about bench-based researchers, people who are doing basic research feeling, I don't even know where to start in terms of PPI.
Yeah, so I think that you can see the benefits, and you've all just described some of the benefits of involving patients and carers in clinical research. But I think for bench-based, lab-based researchers, it's much harder for them to see why they would do it. So I think there is a real, not a battle, but a series of conversations to be had with lab-based researchers, some of whom, or a lot of whom we've talked to in the UK, say, well, I don't need to do that because I work with mice or flies, or I look down test tubes, or those things. So I don't need to directly involve patients. So I was part of a study that talked with some lab-based researchers before they did some PPI activities, and then talked with them again afterwards, and the people who got involved, and we developed some guidance about how to do it, which I'll put the link to the guidance in the chat. And some of the things that the lab-based researchers talk about being worried about is things like, I wouldn't know how to find people to involve. You know, I wouldn't know, even if I could find people, I wouldn't know how to do it. Like, how would I involve people? And if I did involve people, how would I do it? What would I do if somebody dominated the conversation? You know, what would I do if somebody was really against animal research and I'm working on research with mice? How many people should I involve? Is it all right if I only involve 3 people? You know, am I going to get hammered by my funder if I just say I worked with a panel of 3 people? So those are some of the worries that we've got. And I would say really there's kind of 3 key bits of advice that the lab-based researchers and the patients and carers who work with them came up with, having been involved. And the first bit of advice is kind of obvious, but it was about just go and get some help from somebody. If there is, like, I guess for you guys in Ireland, you've now got PPI Ignite, so that would be a really good place to go to. A lot of our researchers, lab-based researchers, are going to their funders. So it's the charities that are funding them, and the charities are then helping them to find people to involve and support them to do it. So first thing is, you know, get some help. The second thing is prepare well. So it's really interesting what Catherine was saying about getting researchers to think about, why do you want help? You know, what is it you want people to do? How are you going to run that meeting? What are you going to do if somebody does dominate the discussion? So real thinking about how to prepare well and how to write about your research in plain English, how to explain what your research is about in plain English. And then the third bit of advice that was given, which I thought in a way was the nicest bit, was just don't be scared. You know, give it a try. It might not work brilliantly the first time, but no one's going to shoot you for trying. And most patients are so interested that something is happening in the condition that they're living with. So I think people are much nicer than researchers often are worried that they're going to be. I won't say any more, but I will put the link to the guidance in the chat now and hope that people can see that.
Just to finish up, because we're now more than a few minutes over, could I just get each of the panel members, if you had one piece of advice for a researcher or part of a research team who hasn't actually engaged in PPI so far and is wondering where to start or may have concerns, would you like to just give that one piece of advice now?
Yeah, I think, I mean, you know, and it's been touched upon, I think there's obviously, you know, it's almost to Beck's point a little bit, like find someone to talk to who's done it or can help you with it. I think that's the key thing. I mean, I think one thing I've learned as someone coming from this area from the outside, it's superficially simple. When you get underneath the surface and you take all the interpersonal components, all of the ethical components, all of the making sure you're doing something meaningful, as opposed to just ticking a box, which you may not be setting out to do it in a cynical way, but just making sure the engagement is meaningful. So I think, yeah, and I mean, I think the movement, for want of a better word, grows in Ireland around this. I think knowing where to go will become more apparent for people when they're setting out.
Patricia?
Yeah, again, to echo what Beck was saying, just not to be afraid of it, you know, and I come from a translational lab research area myself, and I know I was very intimidated and frightened by speaking with patients, especially in the cancer realm. You know, it's highly emotive and can be quite upsetting, and depending on what part of the journey you're actually speaking to somebody about. So what I would say to any of the cancer researchers out there is to not be afraid, that there is support. I mean, Catherine does fantastic work with the PRG, and they're so engaged, and that they've developed this framework for you to start with. So it's, you know, it's not so intimidating to start with. And anybody that I've spoken with after they've met with the PRG has been incredibly impressed and delighted with the feedback, you know, and this is coming from some basic researchers who, like you said, Beck, you know, they're looking at a gene and they think, I don't need to speak with patients, it's so far removed. It's not. There's always something to keep it cancer focused. And I think especially for us to be part of a cancer institute, it doesn't matter what stage of the research cycle you're on, it all has to remain patient-centric.
Thanks, Catherine.
I think perhaps if the researcher approaches somebody who's actually been through the process as well, and maybe to hear from a researcher who's just new to this field and who actually has presented to PRG or whatever, I think that would be really, really useful and helpful, you know, not to be afraid.
Great,
You know?
thanks.
Yeah.
Deirdre?
Again, agree with everybody there. The first thing is to reach out and get help and listen to someone who's done it, because in all of the years that I've met different people at different levels of PPI, I have never met anyone who's regretted doing it. And
Great.
everybody who just says it made such a difference.
That's great. Thank you, Deirdre.
Done it.
And finally, Beck.
Well, I cheated and snuck 3 in before, didn't I? But I think if I could have another one, it would be about trying to talk about that it's about, a lot of it is about building relationships with people, and that involves give and take, giving up. You know, researchers can't have it all their own way, patients can't have it all their own way. So I think it is about getting researchers to think about that, about the fact that it is about relationships. It's not about science and protocols. You know, there's no one way to do it.
That's great. Thank you very much to the panel. I really appreciate your time. And now if I could hand back to the Dean in order to finish up proceedings. But thank you once again to the panel.
Well, thanks, Michael. I'm not going to keep you any longer, except to say I really enjoyed the afternoon. I learned a huge amount and given us all, I think, a great deal to think about. So I would like to once again thank very much the panelists, the speakers, yourself and Nina for organising it. And stay tuned for the next event in the faculty forums, and any suggestions that people have. We'd be very happy to take them on board for future events. So thank you all, and